We are recording. And so I would like to go ahead and welcome our first presenter, who is going to be Anthem Blue Cross, and they are going to take it from here.
I would think after a year I'd be able to unmute myself. Sorry about that. Hi, everyone. My name is Alicia Pimentel, and I'm the program manager here at Anthem. And I am in the liaison with our HHS department, so behavioral health and public health. I also have one of my colleagues on the line. I'll let her introduce as well. Rachel Sanchez. Well, I guess I just introduced you. Sorry, Rachel. But I did have a quick question. I know we received some questions in the sake of everyone's time. So we do have a PowerPoint that we're going to present or co-present with Ariana from California Health and Wellness, because our benefit is very similar. So we aren't repeating the same information. So we'll kind of make sure that we're answering those questions throughout the presentation. If you have questions at the end, we'll be happy to answer those. And we'll go ahead and get started. I think Ariana has been gracious enough to offer to share her screen. And I will also just ask that Rachel, if you want to go ahead and introduce as well, that'd be great.
Hi there, Rachel Sanchez. I'm Community Relations Representative with Anthem Blue Cross. Thanks for having us.
Thank you, Rachel. Awesome. Thank you, Ariana. So both of the health plans, it is a state requirement that Anthem and California Health and Wellness are required to provide transportation to our Medi-Cal beneficiaries in all of the counties that we serve. So Anthem has 29 counties in the state of California, where you guys are located. Obviously, there's several counties that I'm sure your clients cross over: Sutter, Yuba, Colusa, maybe even to Butte, Sacramento. So we do provide transportation, and so we'll kind of go over what the requirements are for accessing that transportation, and then also a few of the differences and the questions that were asked by the coalition. So, and I think that, I don't know, oh, go ahead.
Can you see the presentation, or do you see the PowerPoint? Does it look okay?
Yeah, I don't know if you can make it in presentation mode, but it's okay. I don't know if everybody sees it the way I do, but if not, it's okay. I can see it. Go ahead and keep going. Thank you, Ariana.
Okay.
Yeah, we're seeing the whole slide deck instead of just the presentation.
Oh, you are? Okay. Let me go back. Give me 1 second.
Thank you. And just while she's, oh, perfect. There we go. Okay, so Motive Care, I'm still getting used to the name, sorry. Used to be Logisticare. They changed their name, but my understanding is the same company, and anyone can clean me up on our Rachel, but they're still the same company. They changed their name, but they are a company that Anthem contracts with and California Health and Wellness contracts with to provide transportation services to our members within our counties that we service. So they schedule our appointments. Their number is on the back of the member cards, and our members go through them to schedule not only if they are being transported by someone through Motive Care, or if they are having a family member transport them, which we'll talk about, and they're being reimbursed for those transports for mileage. So as you can see here, they credential, contract, they work with local providers, whether that be taxi companies, Lyft, they even contract in some of our counties with, the county agencies to provide those transports. And they provide non-medical transports as well as non-emergency medical transports. And you can go to the next slide. And I'm okay if people want to ask questions throughout it. I don't know if it's better to wait at the end, but so these are the types of levels of service. So non-medical transportation, that would include, like we talked about, mileage reimbursement. So let's say you have a family member who can take you to your doctor's appointment. They can go ahead and take you to that doctor's appointment and pick you up from that doctor's appointment and then be reimbursed for that transport. Mass transit or paratransit service, ambulatory, like we talked about, Lyft or taxi. And then you can go ahead and go to the next slide. These would be an additional level of service. So if they needed a wheelchair van, or there were additional, maybe the person's disabled, if they needed an ambulance, Someone's asking a question. I know someone's wondering in the chat, but if someone needed an ambulance, and they do air transport as well, a gurney van, things like that. So they do need to have a form signed off on the NEMT transports, and we'll go ahead and talk about that in just a second. Thank you. So the PCS form, so for NEMT, levels of service they do require, so that air transport, like we talked about, if they need a gurney or an ambulance, things like that, it does require an authorized signature from someone in the doctor's office. Typically it's a PCP, you know, it could be a PA, things like that. The NMT services, they do not require a signature for that form. That would be, you know, if they're going to a pharmacy to pick up prescriptions, if they're just going to a doctor's appointment, that's not going to require a signature. They will verify that the member has a doctor's appointment to make sure that they are actually going to that location for the actual doctor's appointment, but the member won't know about them verifying it. And that will be the reason for them needing that 5-day advance, which we'll talk about in a little bit, to make sure that they can verify the services that the member is receiving. The PCS forms, as you can see here, oh, sorry, if you want to back, I'm sorry. They're valid for, no, it's okay, Ryan. They're valid for, I think, up to 12 months. But it really depends on the doctor's office, and, you know, maybe the member will be going on a monthly basis. So let's say they're receiving services for, let's say, you know, they're going to behavioral health and they're going to be going on a regular basis. They'll fill out that form and they won't need to refill it out, you know, every single time they go. So they'll do it a longer period of time, like a 12-month wait. Okay, now you can go. Thank you. So these are, you know, typically this is what's asked when the member makes an appointment. Name, date of birth. We do data dumps on a daily basis. My understanding is both plans do this. So we will give them our member data on a daily basis, so they have it. They can verify eligibility when the member calls. They'll need to know the level of service. If there's a PCS form on file, obviously the trip characteristics, sorry, pickup address, drop-off locations, phone numbers, things like that. They will confirm with the member at the end of the ride, and then recap all of the information to make sure it's correct. There may be special required. Oh, sorry.
Oh, I'm so sorry. I didn't want to interrupt. I just wanted to add in that it's really important that the member, or if you're helping a member to schedule a ride, that you include as much information as possible. So if they have special needs, like if they have a wheelchair, or if they, you know, have a service animal or anything like that, to include all of that information. Sorry, I didn't mean to interrupt, Alicia.
No, it's okay, Rachel. That's helpful, actually. And to Rachel's point, especially, I think this is also helpful. I mean, we've had times where, you know, maybe members are being picked up in a rural area, and any information that they can give them, like, you know, the mailbox is red, where they're picking them up at, the driveway is really long, things like that, so that they understand, you know, where they're picking them up, and there's not any delay in them arriving to pick them up for that transport.
There was one other question in the chat. It says, what are the requirements for reimbursements to family members providing transportation?
Yeah, and we'll go ahead and get to that in just a second. But just, or I'll answer that in just a second, but there are requirements, and they're pretty similar to the requirements for scheduling if they're going to be using like a Lyft or anything, or one of the contracted providers. So we'll go over like the wait times and things like that. So again, member information for a routine reservation, name, date of birth, medical ID, date of service, level of service. Again, you know, what type of trip, pickup, drop off locations. The return will be scheduled as a will call. So there will be a 1-800 number that they can call once they're done. So let's say they're going to an FQHC for a doctor's appointment. Once they're done with their doctor's appointment, they will go ahead and call that number, and then the provider has an hour to come back and pick them up from that time. So they're not going to sit outside and wait for the member. They will need to call and have them come back to pick them up. And then oh, sorry. Yeah, no, keep going. I didn't have anything else on that. The one thing I will add is, so there is it's 5 days if the member already has been established as being eligible to receive services for or through Logisticare or Movid Care. They have a 5-day wait time. So for regular routine appointments, but this is if they do, if let's say they're being discharged or they have need to go to urgent care or something like that, it's up to a 4-hour wait. So again, for the routine ask, the level of service, trip characteristics, special note at the end of the call, they will advise them, give them a trip ID, and then they'll be able to call that number to figure out what's going on with their ride if maybe the driver's late or something like that. Okay, so discharge same day request. So the initial call for transportation, it's the same reservation request, but it will be advised. They'll get a trip confirmation number, a follow-up call to advise the assigned transportation provider. They will continue to update the member or whomever has requested that trip. So let's say they're being discharged and they have a discharge planner and they're being discharged from, ride out. They will keep in contact on an hourly basis to let them know where the driver is and when they will be picking that member up. They do have a 4-hour window to be able to pick that member up and take them. And then again, those discharge, urgent care, things like that would be a 4-hour wait time for those. So this is just an example. Router calls at 12:30 to confirm they've accepted the trip. The router will call back and let them know when they're going to be in the area. And then the router calls back at 1 p.m. to advise they're still working on securing a provider. So, it may change. They may have somebody that's accepted the trip. It may change, and maybe they have special requirements and they need a different vehicle or something like that. So that's why they do give that 4-hour window. It's not always 4 hours. It can be sooner than that, but it is up to 4 hours for them being discharged. So here's our reservation line. It's different, and I think Ariana will go over her information, but Monday through Friday, 7 to 7 is when they can make the appointments. Advance notice, I think we talked about that. So the member does need to call 5 days in advance. They do get some courtesy trips. I think it's 3 courtesy trips per member. So let's say they had a specialty appointment and somebody canceled and they can maybe get in tomorrow and they didn't know. They do get 3 courtesy trips where that 5 business days rule does not apply. They do need to call 7 days in advance if they're not already in the system. So let's say they're a new member and they have never used this reservation line before, they would need to call 7 days in advance to make sure that the company can determine eligibility and that they're able to make sure that they're in the system. The 5 days is also for anyone that will be transporting and receiving mileage reimbursement. The members, whoever's transporting that member will need insurance. They'll need to give their vehicle information. It cannot be the member transporting the child. So it would have to be like a grandmother, or let's say an aunt or an uncle or a cousin or something like, it could be a neighbor. They can transport the members. And then advance notice is not required for the following. So dialysis, chemotherapy, radiation therapy, urgent care, wound care, discharges. I will also say that for Anthem members, they can also go to a food pantry or to social services. The same requirements apply. There are no trip limits for Anthem. It's up to 75 miles each way. And then after that, they do require a form, but the member won't know about it. It'll just be signed off internally. And there's no real limit as far as they can pretty much go as far as they need to go. There are COVID restrictions. I know that was one of the questions. So members will be required to wear a mask. They will at this time not be allowed to take anyone with them unless it's a parent transporting a child to an appointment. And then also they can go for testing. They can go to get their vaccine, things like that, but they will need to be dropped off and picked up. They will not be able to go to like a max vaccine site where they drive through and sit in the car just to protect the driver. So again, they will need to wear a mask. They cannot bring anyone with them unless it's the parent transporting the child to the appointment. And then they will need to be dropped off and picked up for testing or for COVID vaccines. And then again, one more piece for Anthem members that are using the benefit to go to social services or to, you know, a food pantry. They will need case management assistance. So instead of calling Logisticare or Movicare directly, they would contact Anthem, and then we would make sure that we set that transportation up for them so that they don't receive any barriers, because it's a little bit different and sometimes they will get some pushback on their end because the two plans have a few differences as far as that goes. I don't know, Rachel, if you want to add anything, but I think there was some questions.
No, I think you did a really great job, Alicia.
Oh,
Sorry.
No, go ahead.
I think some of the other questions might be addressed in the slides that are following that Ariana is going to go over as well.
Okay, great. Thanks. All right, thank you.
So I just
Great.
wanted to chime in that we're coming to an end of our 10 minutes for our Anthem Blue Cross. If you have a few more items you want to cover real quick, we can do that, or we can move on to our next presenter, and we can definitely be sure to share your presentation with the group if you think that's best.
I think, it's a dual presentation. So Ariana is going to cover the second half, and then we pretty much I went over the differences between the two. And if there's questions at the end for Anthem, I'm sure Rachel will be happy to answer them. Thank you. Thanks, Ariana.
Thank you. Thank you. Thank you, Alicia, and thank you, Rachel. Okay, so we'll go ahead and get started talking about California Health and Wellness member information. So just as Alicia presented, some of the same rules apply since we are working with the same transportation vendor. The only difference is to request transportation, our members will contact member services through California Health and Wellness. The phone number is on the back of their ID card and listed here. Our reservation hours are from 8 a.m. to 6 p.m. And then the same advance notice requirements that Alicia stated apply for California Health and Wellness members as well. In addition to advance notice for urgent trips for dialysis, chemotherapy, urgent care, etc., those can take up to 4 hours to complete. If a member has questions regarding their estimated time or modifications to the reservation or to file a complaint, they will still contact that same member services phone number, again found in the back of their ID card. And language assistance is available when they contact that phone number as well. So for facility or providers, if you all have any clients that you're working with that need assistance with scheduling transportation, the provider wouldn't call our member services line, they would call the facility assistance line. And this number is the same for Anthem Blue Cross and also for California Health and Wellness. So again, you guys can contact this phone number to request routine transportation, request urgent standing orders or discharge transportation, check the status, or file a complaint or ask a question. And this is only for providers or facilities to contact, not for members to contact. Please keep in mind that the health plan reservation hours do still apply that Alicia and I mentioned. And in addition to the advance notice requirements also apply as well. So a standing order is created for your clients to require any number of trips weekly, as long as it's at least 31 days or more and follows the same schedule. So for example, if I had a dialysis appointment every Monday, Wednesday, and Friday at 8 a.m. with an 11 a.m. return time, a standing order would be created for me. So the company will obtain all important information for your client. They're going to verify the client's eligibility, their plan benefits, and any trip limits that are considered, if there are any. On a monthly basis, Motive Care will contact the facility or the provider via fax to get more information about the member's attendance at the facility. So just getting information about their appointment. And then on a quarterly basis, they'll contact the provider via fax to make sure the member is still going to their appointment and that the information regarding dates and times are correct. And I think Alicia mentioned that earlier as well. Logisticare or Motive Care, they have a website called TripCare, and the website's at the bottom of the screen, tripcare.logisticare.com. And TripCare supports transportation requests by healthcare facilities on behalf of their clients. So the website's just available for you to help manage and request trips instead of calling that facility line that I gave you guys earlier. So again, you can look up review trip requests, you can modify pending requests or update requests, cancel requests, or complete any standing order paperwork. And this is just some brief information on how to get started with Trip Care. So if you would like to sign up for Trip Care, you would just contact that facility assistance line that I mentioned earlier, and we'll send out this slideshow at the end of the presentation so you all have it. But you would contact the facility assistance line, or we can contact you with our outreach coordinator. They'll have you fill out a electronic data interchange form, EDI form, and fax it back over to Motive Care. And then they'll issue you a login username within 48 hours. And then once the administrative user is set up, you can create additional logins for other employees in your facility as needed. And if they're interested, we can contact or connect you with our outreach coordinator to schedule a webinar so they can do a demonstration for you and for your staff. So some frequently asked questions regarding Motive Care for Anthem, Blue Cross, and California Health and Wellness managed Medi-Cal members. So who can schedule and call a transport for a member? So the member can call, caregiver, provider, case manager, pretty much anyone can help schedule a transport for somebody. And as Alicia mentioned, there are no trip limits for our Medi-Cal members. So again, no trip limits. What type of appointments are covered? Transport to and from medical or wellness appointments. And then I think Alicia did touch on some of the services that are covered, and there are different covered services per health plan. I know in ours, I think we mentioned pharmacy, durable medical equipment, picking up those devices is covered. Going to some support groups is covered for California Health and Wellness members. Not too long ago, I can't remember when it came out, but for pregnant women going to WIC appointments, that's a covered benefit as well. So there's a list of covered services, and you or a member can always call to find out if an appointment is covered. Are there service area limitations? So for Anthem Blue Cross, ground transports for over 75 miles one way and fixed wing transports will require prior authorization from the health plan. And then for California Health and Wellness members, for ground transports over 200 miles one way, and all air travel will require prior authorization from California Health and Wellness. Any trips over 100 miles of the California border will also require prior authorization as well. And Motive Care will just contact the health plans to obtain the authorization. Again, pharmacy is a covered benefit, so they can request transportation to a pharmacy to pick up their medication. There is no copay for transportation since these are Medi-Cal recipients. Can the member take an escort? So I think Alicia mentioned this as well. Yes, the member and one additional passenger are allowed in the space available, case-by-case basis based on the health plan's contractual obligation. So as Rachel mentioned, the more information, the better when scheduling your appointment, letting them know who's going to be coming with you, if you have any restrictions or, whatever assistance you may need. And if you are bringing a child with you, you must provide your own car seat as well. How long does a member have to wait to be picked up from their appointment and return home? So members can call the Ride Assistance Line to schedule return trips. And as Alicia mentioned, the provider has up to 60 minutes from the time of the call to pick up the member. And then if you as a provider or facility has any questions, again, you can also call that California Facilities Line to schedule return trips or inquire about, the status of the trip. And that's all we have. Any questions for us? I know we gave you a lot of information, and again, we'll be more than happy to send over the slideshow at the end of the call.
Yes, this is Adam from Yuba Sutter Transit. I know we
Hi.
don't do medical billing slash and whatnot. We require payment at time of service. Do you do reimbursement, or how does that work if they did try to use our local transportation service?
Rachel, do you know about that one? I'm not too sure how it works. If we use your, I'd have to ask to see how that works, because we do provide mileage reimbursement, but it's you know, an individual. So I'd have to ask about that, Adam. I can get back to you on that.
Well, this is a public transportation, so this is just they'd show the fares paid, whatnot, to get to a service, or I don't know if that's an option or how that would work out to use Yuba Sutter Transit.
Oh, I understand. I'm sorry. So I know that there's been cases where we provide bus passes in the past, but let me get information. Do you have anything to add, Rachel, about that?
No, I was just going to mention the bus passes as well. I think that we'd have to go back and ask about reimbursement if they already purchased a ride on the bus. Yeah, but that is something that's available if requested when they call to schedule their appointments.
We'll have to get back to you, Adam, on that one.
Okay.
I have a question. Can I ask my question? So you gave a number that was for facilities to call, but so I think that everyone in the room is, well, some of us might be facilities, but I think also the majority of us are like case manager kind of folks. And so so would they call the normal line, or would they call the facilities line? Like, what's the difference right there?
I would recommend the facilities line. For us, the member services line is just for the members only. And the facilities line, I think, would apply for case managers, providers, facilities, etc. Any other questions? Rachel, anything else to add?
I have one question. What about any Social Security appointments, especially like doctor evaluations for Social Security cases?
I want to double check to make sure. I'm not sure about Anthem. I know that I've seen that as a treatment type, Social Security, but I'm not sure what the situation was specifically. So I can check on that benefit for you as well.
Okay, thank you.
You're welcome.
Well, I just wanted to thank Alicia, Ariana, and Rachel for your presentation. That was definitely a lot of information. I know I didn't know. So thank you again. I would like to go ahead and have us move on to Yuba Sutter Transit, please.
All right. This is Adam Hansen from Yuba Sutter Transit. Good afternoon. Are you seeing my screen? Awesome. All right, so my goal is today to have a discussion. At the end, you should be able to confidently tell your clients how to ride transit, where they can ride transit, and what they need to do to qualify for any special transit. And so if we don't achieve that, then I guess I failed, but until then, let's plunge forward. So here you see our Connect card at the bottom corner. We'll be talking about Connect card a little bit later. So those are electronic fare cards that we issue to people, so you can just tap that and get on the bus. Passes can be loaded, cash can be loaded, and you can get on the bus. The good part about using that, even if you pay cash, is you tap twice in one day. The third tap, you don't pay. Fourth tap, you don't pay. So after 2 rides, you paid cash off a Connect card. After 2 rides, you're free for the rest of the day. We try to make transit convenient and affordable for everyone that needs it. And so that's one way we've done that. All right, well, so services offered. Of course, you've seen our fixed route buses that circulate around town. We have 6 routes that serve Marysville, Yuba City, Linda, and Olivehurst areas. And those are the medium-sized green buses. Then we have the dollar ride buses, the little white cutaway buses that you've seen. Those take people curb to curb service. for people with disabilities, seniors, and after 6 p.m. it's free and open, or not free, it's open to the public. And then the big buses you see going around are the commuter buses that leave from various locations and go down to Sacramento. We'll talk about that. And then we have rural route services to Live Oak, Wheatland, and the Yuba County foothills. Right, so fixed route, we got hours there. We don't operate on certain holidays and Sundays. Sometimes Sundays is a sticking issue for people that need it to get their jobs and whatnot. But for now, we don't operate on Sundays. The good news is we have 2 different grants that reduces our monthly passes for the general public from $30 to $10 a month, and for discount passengers from $15 to $5 per month. So basically, if you're general public, you pay $10, or you can pay $5, and that's unlimited rides on the fixed route system. And then you get those on your Connect cards. If there's any questions, just stop me and I will answer them. Let's make sure everything's clear as we go along. And then Sacramento service, if anyone needs to go to Sacramento, we have park and ride lots. We also go to Sam's Club, Bogard Park and Ride in Yuba County, Yuba County Government Center, McGowan Park and Ride, and Plumas Lake. And so the fare is basically $4.50. We do have 3 afternoon trips that are $2.25 if you qualify for one of the discount fares. That's only for like the midday trips down to Sacramento. And it basically goes down to Sacramento and loops around the capital. So from there, you transfer to RT, light rail, and other services to get where you need to go. And then the Dollar Ride service, curb to curb for seniors or person with disabilities. To qualify for disability, a Medicare disability letter or card, a handicap placard, or you can go get one of our forms signed by your doctor, and that can qualify you as well. So you can call same day. We'll try to accommodate you, but you can call up to 14 days in advance. The fares are there. But after 6 o'clock, I said it's open to the public. And for the public, it's $4. And for people that qualify, seniors and youth, it's $2. And so that can take you anywhere within our service area, which I said is Yuba City, Marysville, all of First Linda. You can see that in our ride guide brochure, a map of our service area. And then rural routes, Live Oak, Foothills, and Wheatland. Live Oak and Wheatland are 5 days a week. The Foothills are only 3 days a week. We may look at expanding that soon once ridership returns. I think one thing I forgot here at Dollar Ride is we are offering free rides to vaccination centers. So you can ride the fixed route or the Dollar Ride routes. Just if you have the appointment on your phone, have the appointment, show the driver the appointment paper, and jump on for free. And we'll take you there and back. It's no problem at all. Some people are definitely taking advantage of that. And so if you haven't been to our website, the address is there. I'm hoping it's pretty easy to use. Right now, it's just showing the bus tracker. It basically lets us know if bus is later on time and you're waiting at a bus stop. You can pull that up on your phone, download the app and pull it up on your phone. You can see when the bus is going to arrive, see if you've missed it, and so you can plan your trip accordingly. So that's one of the cool technology features we have. But even more so, every one of you should be a transit expert. This is the trip planning tool. At the end, if I have time, I'll go show it to you. But it's basically goes to Google, and at Google at the top, you can go to Drive. Right next to it is a bus, or actually kind of like a rail car. That's what it shows on Google at the top, and you get directions. You can click on that, and you can enter in an origin and destination, and it will tell you what transit routes and what you need to ride or where you need to go to complete the trip using transit. There's also across the top, they have bike and walk, and I'll show you all the various times there. So this is a very good tool. Sometimes people call me and I'm like, oh, I just pull this up and use this rather than try to go through the schedules and mesh the buses and whatnot. And so that's me. If you have any questions, you can give me a call. If you have any issues with our service, I'm also the person you talk to. You call our dispatch office at 742-2877. They schedule the direct trips. They can answer questions, whatnot. But if anything that they can't help you with, they would pass on to me. and I'd be able to help you and point you in the right direction if we can't help you. So with that, I'll be willing to answer any questions.
I think there's one question in the chat. Is the form to have your doctor sign for Dial-A-Ride available on the Yuba Sutter Transit website?
I believe so. Yes, I'd go to the Dial-A-Ride and usually you click on like discount fares, I believe. And I think the form is under there.
I have a question. You mentioned the Foothills only travels 3 days a week. Are those specific days? What days of the week would that be?
It's Tuesday, Wednesday, Thursday.
Are there any plans of expansion outside of what is, or to expand?
Does expand, you mean our service area for fixed route or for the direct service?
Yeah.
So our direct service, if someone calls and they live right outside our service area, I mean, we've got like a 1/4 mile buffer. We'll usually give them a ride. There's been a little bit of pull to expand into Plymouth Lake. Currently, we only serve them with commuter service at the Plymouth Lake Park and Ride. As Plymouth Lake grows, that may be an option in the future. But besides that, we do serve most of the larger populations in the 2-county area. So at this time, we don't have any plans to expand.
So how would you go about getting an extra length on a leg? I think I know where your Melda's going with this. There's a new project out on 99 that you guys have a bus that hits Bug Road, right?
Yes.
So what would it take to get that bus to take a left on 99 and go another half a mile?
Keep going.
Yeah, and just right there by that truck stop where they have the Harmony Village now.
Yeah.
We have a lot of clients out there that need extra transportation. And I think it would be a huge lift to just, dial ride all of them. If we could get a bus maybe 3 times a day, do that extra leg, what are the possibilities of that happening?
Yeah, you just call the transit manager. We would be glad to talk to you to figure something out. We'd have to see, there has to be a decent amount of demand to actually route a bus down there and make everyone else on the bus drive down there and back. So it'd definitely be a extend the service and whatnot.
10 minutes.
What is a decent amount of demand? What would that constitute?
How many people need to call?
Oh, call to request that service? I think we want to partner with the organization that's running that facility at this time. I mean, give us a call. Maybe we can, like I said, work something out. So we're going to extend Dial-A-Ride down there or do something.
Okay.
I think that's probably best. Having a bus go down there 3 times a day. I mean, there'd have to be, 6, 8, 10 people rode it each time it went down there to at least make it worth a while to go down there. Go down there and 1 or 2 people riding it. It's like, why not send a Dial-A-Ride down and not deviate a fixed route down there?
Yeah. Okay. Thank you. I'll be calling you.
All right. And what, Ms. Mendoza, what organization are you with?
Sorry, Sutter County Public Health. So we're partnering with Habitat for Humanity. So they provide, they own the building, and Sutter County provides the supportive services. So we have 62 units of permanent supportive housing, low income individuals. The majority, I think only 4 have vehicles. So the majority are relying, currently Habitat provides transportation into the city 3 times a day. And so it would be, as Rick Millen mentioned, a huge lift and huge benefit to those residents out there. They just moved in December. So this is a very new low-income housing project outside of the Yuba City area.
So that's at the old hotel right there by the truck stop, correct?
Yes.
That's cool. I didn't know people were already living in there at this time. So what does Habitat for Humanity use? They just have some vans that are doing it currently?
Yeah, they have a passenger van that they're providing transportation into town. And so they have 3 scheduled sites. That happens 3 times a day. But sometimes, it doesn't work for those that are working, or if they have a doctor's appointment, there's just, or mobility issues. It's because the locations that they're being dropped off are 3 fixed sites. So we just want to make sure that if there's a possibility to increase transportation over to Harmony Village, that we explore that option, because the majority of these individuals are disabled. They're all low income, and they have appointments, from throughout the city. So,
Understandable.
Yeah.
Okay. I wanted to thank you for your time, Adam. That was all very informative. If possible, would you be willing to share your presentation with us as well?
Sure. Could I send it to you so you can send it out? That'd work.
Yes, absolutely. Absolutely. So we're coming to a close with our meeting. We did want to do one last breakout session just to kind of get our thoughts moving on this. We have a lot of great resources that Yuba Sutter Transit provides, and Anthem Blue Cross and California Health and Wellness. So I really want to thank all of you for presenting today, because I know I definitely learned a lot from all 3 of you. So I'm going to jump into our collaboration question for today, which is, I want us to go ahead and think about our agencies and think about, does your agency offer alternative methods to access services when there are transportation challenges, such as, offline service, offer online services, or provide transportation for travel for clients through your department. So we're going to do breakout sessions. We're going to put you in your rooms. There's no Google document or anything. We just want you guys to kind of talk about it. I'm going to give you guys 3 minutes to kind of have some discussion on what your agency does to help our clients, our customers. And if you could pick a spokesperson to kind of talk about what you guys discussed. We'll come back to the main room and share, and we'll call it a day. So Kaya, will you please break us out into our breakout rooms, please? And I think we're all here. I hope you guys had enough time to kind of talk about the services that your individual agency provides. Would group or room 1 like to share? Or if we didn't pay attention to rooms, we don't have to go that route. I realized I didn't give that direction. But would someone from one of the breakout rooms like to share?
Hi, everyone. My name is Maria Quintero. I was in room 1. I'm from Ampla Health, a federally qualified health center. And I was sharing what Ampla Health has available in regards to transportation to all our established patients. We provide transportation to the facility, and patients also have that service available elsewhere. If they need an appointment with behavioral health, they just need to connect with us, connect with the clinic, call the facility, or our 1-800 number. We work very closely with Anthem Blue Cross and California Health and Wellness, as well as Dial a Ride in the transit. So we were sharing that again.
That's great. Thank you so much, Maria. Would anyone else like to share about what their agency provides?
I'm Amy Molina Jones with Yuba County Office of Education. The County Office of Education does not offer transportation, but we do work with our districts to try and get transportation taken care of for our school age youth. But beyond that, during COVID and moving forward, there's several services that we have offered online, such as parenting classes. So that's That's been a nice change. And to access those services, you can reach out to me directly.
I'll go next for room 4. So I work at Freed, and at Freed we do provide some vouchers for transit dial-a-ride transportation. Those are for older adults 60 and over, and that's funded by Agency on Aging Area 4. Right now our list is pretty full, but we start up again at the end of the fiscal year, so the end of June, then we start signing people up again. There's that, and it kind of around the COVID stuff, we started using Lyft as a concierge service to get people where they needed to go for especially medical appointments. And that's been semi-successful. Sometimes it's hard to find a driver in our little Yuba Sutter area. And then more recently, we've used some COVID relief funds to provide taxi cab rides for people who were going to get their vaccines. So rides back and forth to the vaccine clinics. And Mark shared for behavioral health that they provide transit vouchers and training at the start of provision of services at behavioral health. And then the transit training kind of helps people get their footing, and they connect them up with California Health and Wellness or some of the other places that provide rides. Harmony Health actually has a 9-passenger van and provides some transportation that way, and also vouchers for bus. And you got cut off at the end there, Harmony Health, so I don't know what that last thing was you said. I know you said vouchers for the bus, and I couldn't catch what else.
And we will do dial-a-ride, Lyft, anything to prevent access issues is what we will really try to work with the patients with.
That's so great. Awesome. Thank you so much, everyone who attended today. This concludes our meeting. I just want to remind everyone, our next meeting is May 26th from 12:30 to 1:30. And we're hoping that our next topic will be on behavioral health services. So if you are interested in being a presenter at the May 26th meeting, that would be great. We would love to hear from you. Or if there's a particular provider you would like to hear from, please let me know. We definitely want these collaborative meetings to be informative for everyone who's participating. I want to thank everyone for your time, and I hope you have a great rest of your week. Thank you so much.